I wanted to specifically address what I understand were the areas of concern related to the new justifications, and that was specifically the area of deductions. When I looked at the current fees for those two particular areas, I didn't understand how they had been calculated beforehand. And so I just applied the new hourly rate. It takes approximately 1 hour to do that type of inspection, so the new fee, even though it's a lower fee, is the estimated hourly rate for sanitary to go do that inspection for those two categories. So because this is the first time I had been through the calculation process and I didn't really understand some of the previous calculations, I sent our fee schedules off to the foodborne prevention illness people at the state and asked them to do an independent and objective review of my calculations and the fees. When I looked at the previous justification sheet, it didn't follow what the ORS calculation is, which is the hourly amount times the number of inspections a year for whatever that particular thing is, times how long an estimated length of time it would take, plus the 45 for at least when it was $45 application fee. So that was another reason why I went to the state. Okay, did I do this correctly?
Right. I actually totally endorse the idea that it's based on state statute and a formula that's defensible, as opposed to something that historically might have been a little bit more. Does $200 feel better than $120 or $220?
To say that we were surprised last week about fees in the health department is totally inaccurate. I have met with the director, Diane Hoover. We have been corresponding by email, not only with me, but with the finance office, and she also contacted the state health department in regards to how to calculate, because the state environmental health division actually mandates how these things will be determined. It's in OAR 333-012-053, and it says must shift certain cost of the public health director to these fees. So she calculated all the fees, sent those to the state for their review to make sure they were in compliance with the state rules and statutes. And they approved it with one exception. She had she put in $25 for one of the fees, and $35, and the state said it cannot exceed $25, so she reduced that one. And however, to say that she would claim that we have been overcharging people, the fees that are currently being charged and have been charged for the last number of years have been set by the Board of County Commissioners. They have hearings, just like the fees will this time. We will have hearings. People can come and comment. And those fees were set and voted upon after those opportunities. And now we have a situation where we have a formula that she is complying with to calculate these fees and has put these fees out there for consideration. We will be having a hearing on all of our fees coming up. I don't remember the date on that. I think it's another week or so. But the absurd comment about returning money to the people. What Mr. Matthews is he's talking about less than $300 of the fees that were reduced, all the fees in the health department, less than $300. And if the circumstances change, or if you find that for whatever reason you can find an economy in how you conduct in the inspections, and most of these are in the restaurant inspection area, if you can find economies in the way that is done or how it is reported, we are required to reduce those fees. It doesn't mean we overcharged anybody in the past. It may have been necessary to spend more time on some of those. But I'm not going to try to justify or defend what was passed in what fees were in the past, because they were passed by the Board of Commissioners at that time after public hearings, so everybody had an opportunity to comment at that time. we're working, and that is historical. Anything yesterday and past is historical. What we're looking at today are the fees that are proposed based on the costs in the county and based on what we are required to do under the Oregon statutes. So to even consider about returning money to the people, anytime the government reduces a cost, we don't have to go back and refund money because everything was passed previously based on documentation at that time. And again, we're talking about $288, so all the time that Mr. Matthews is putting in, it probably doesn't work out to be very cost effective for the time he's taking up of our department heads having to talk about it. We cannot, as a board, second guess the actions of a previous director, previous board, or previous hearing. So those are things that are, at this point, historical, and we can't go back retro and try to second guess all of these people, because all these do, just as they will this time, go to public hearings, and people have the opportunity then to make public comment. So, that being said, we're going to have hearings coming up on these fees, and if anybody wants to comment on those fees, they're certainly encouraged to come in and do so. And they're available for you to review and make comment. And if you can't be here, if you're out there and can't be here, you can make written comment on those fees. Do you know the date of that hearing?
I was going to try to remember, but
Let's try to remember the date of the hearing too.
So you'll certainly, after this, especially Cherryl Walker, will talk about all of the reasons why Diane Hoover should be praised, and she's the best health director in the world. And as the previous administration says, our CFO is the best in the world. Some CFO in China is crying her eyes out tonight. But the question still remains, what are you going to do as county commissioners when this happened on your watch and you have the ability to do something about it? I predict nothing.
And I think it only appropriate that we have a very dedicated and diligent and professional department head as Diane Hoover, who is trying to do the very best job for the people of Josephine County, because much of her programs are mandated by the state in regards to inspections and services provided. She's doing, I think, an outstanding job of doing it. That's all I have to say, Mr. Chair.